rally is here to remind you to fight for single payer for your patients and for communities and for yourselves.
I'm here because I believe in healthcare for everyone. I believe that healthcare is a right.
The medical system that we have right now is not working.
We represent the future of healthcare. We represent the future of healthcare policy.
Nearly 7 million Californians uninsured, including nearly 1 million children. And of course, for those of us fortunate to have healthcare coverage, there is an uncertain future.
We are the future of healthcare. We're going to be taking care of America for the next 20, 30, 50 years. Our presence here is representative of our demanding a large seat at the table of reform.
Well, I think it's not only the fact that they represent a whole new generation of activism on these issues, but I think it's the gravitas that they bring because they are medical students and nursing students and even business school and law students. I mean, the breadth of studies that these students represent is also very important.
It's a critical event to bringing together health professional students who understand, because this is the world we're going to enter, the need for systemic healthcare change and reform.
We're the only state in the country that has put a single-payer universal health care bill on our governor's desk.
What we're trying to do is give the students a box of tools to talk about and to take the message around single-payer healthcare out into legislative offices.
We really focus on education. And today is the day where we focus on, okay, what is our message? And then how are we going to frame our argument?
The idea now is to get this time to get you all talking and thinking about it.
The breakout sessions are for people to kind of pick apart different aspects of this bill that we're really asking about our healthcare reform.
So that creates an artificially inflated supply with a low demand.
Students are creating almost new legislature, saying like, okay, well, what's this problem? Having the med students talk about it, and hopefully more doctors talk about it, they're going to fill in the pieces. And this will be more of a whole bill that can actually like ride out.
One thing that it really grabs me is the fact that this movement is getting bigger and bigger every year.
The past 3 years, we've had community members who just, feel passionately and want to come out and rally and be part of Lobby Day as well.
We're building a movement.
What do we want? Healthcare! When do we want it? Now!
For single payer in California. And the more people who are involved, the more people who understand single payer, the more people who can bring their own experience to explaining single payer to people, the better. And these students encompass all of that.
It's a health finance bill. It's how we pay for health care, who pays, and how that works.
Right now, with our current healthcare system, we spend 30% on healthcare bureaucratic waste. What we'll see is basically $8 billion every single year in savings.
Looking at these types of numbers and this type of progression for our health system is going to start making people think that it's possible.
When we try to achieve health reform incrementally, it forces us to split our efforts up into many different battles against an insurance industry that's very powerful and has a lot of resources to use against any kind of change.
It's the perception of this bill in the community that needs to change, and less fear for this change because it's a change for the good. It's a simple change, it's a big change, and it's a good change.
You're not going to change your physician, you're not going to change your hospital, you're not going to change your plan. What will change is how we pay for it.
One of the things that makes Lobby Day, this Lobby Day, so unique is that we don't just go to the state capitol, have a big rally, and then lobby.
We encourage you to get inside that Capitol building and speak your mind and speak your heart and continue spreading the word of single-payer healthcare and SB 840. So go get them.
It's the only way to get cost control in our state and to stop the spiraling healthcare costs.
I think that this is one of the greatest social justice issues in this country, and it's something that we do really need to address as a nation if we want to be a stronger nation, if we want to be a more fair and just and equitable nation.